In the forearm, you'll make a C shape with your non-dominant hand, like this. You'll place the hand on the arm with the fingers above the insertion site and your thumb below the insertion site. Make sure your thumb is not preventing a shallow angle. Then spread or open up the C to make the skin tight. Point your thumb down or away from the needle to be sure you allow a clear path of needle insertion. If you can think of your hand on a clock, your fingers will be at the 2 o'clock and your thumb at the 8 o'clock position. This will allow a clear path for your needle. Maintain tautness of the skin while inserting the needle and while threading off the catheter. If you have to release the skin traction, then simply do not try to advance the needle until you resume skin tautness and vein stabilization. You can also use the base of your dominant hand to help provide skin traction below your target by pulling the skin downward. You also gain more precise control of the needle since your hand is stabilized on the arm. Notice how the vein moves. It moves around. That's what we call a rolling vein. The skin is not tight. To stabilize the vein, we make the C shape and we spread the skin tight at the insertion site. And now notice how that skin is tight. It doesn't want to move. That will stabilize the vein with needle insertion and prevent it from moving away. In the wrist, you can bend the wrist to just the right angle to tighten the skin, but not so much that it will compress the vein. The same concept is used in the hand. You will bend the fingers down and use the thumb to pull the skin tight just below the knuckles. Sometimes there are really nice veins near the base of the thumb and index fingers that have worked really well for IV access. At the base of the thumb, you'll bend the thumb down and pull the skin tight with your thumb. Every patient is unique, so you may need to try different techniques to see how you can best stabilize a vein. Loose skin and adipose tissue can be challenging when trying to obtain IV access. You can check how well it is stabilized with your finger. If you're unable to stabilize the vein properly while trying to modify different techniques, then try looking at another area of the arm until you find a vein that can stabilize.